Welcome to Small Business Celebration. We're continuing our series on small business sustainability. And our guest this week, well, it's all about the heart, the business that makes the heart beat. This is Small Business Celebration. Welcome, where we're celebrating small businesses for big breakthroughs. Welcome to Small Business Celebration, and our guest this week is Dr. Atul Aggarwal, the owner of Atul Aggarwal MD Cardiology Clinic. Welcome to Small Business Celebration.
Thank you very much for taking the time.
And for visionaries who don't know who you are you, and what is it that you do?
My name is Atul Aggarwal, MD, and I have a group practice that I started back in 2012. So about 11 years now. I have one more cardiologist who joined my practice a year ago, and I do have 4 mid-levels who help me in the practice. So I've been in Bakersfield since 2009. I'm originally from India. I did my med school in India, and I did my residency in Syracuse, New York, my cardiology training in Burlington, Vermont. And I was with a practice in Nebraska for 5.5 years. And
you have been everywhere.
I did my training in Northeast.
Okay.
7 years in Northeast, 5.5 years in Nebraska, and 14 years now in Bakersfield.
What brought you to Bakersfield?
Part of it is the climate.
Okay.
The climate here resembles a lot the temperatures in India.
Right.
And 2 is the diversity that Southern California brings to where we are. And so this is the place where we hope to call home long term.
Like you mentioned, you grew up in India, and you met your wife there? What brought you to the United States?
I came to US in 1996. Heart disease is too prevalent in India, so much so that we don't even know the full ramifications and the prevalence of disease in a systematic fashion in Southeast Asia.
Really?
So, and heart disease is rampant. It was some of this is family influence. Acquaintances in my father, he had heart disease at a young age, so it just propelled me into pursuing cardiology training.
Was your family in the business of medicine in India, or is this something that because of your father that inspired you to become a physician?
My father is a family practice doctor. Okay. And my grandpa was also a practitioner till he died.
Runs in the family.
Yeah, my father in the city where I'm from. He was one of the oldest practicing physicians in that town.
Did they encourage you to come to the United States?
Not per se. It was that cardiology was very rudimentary in India about 25, 20, 30 years ago.
Right.
So I was getting training in one of the bigger centers in New Delhi, India. Unfortunately, just the way everything was back then, there was everybody was attracted to for high-level studies to come to US.
Most physicians, correct me if I'm wrong, don't immediately go out on their own. They often start as part of a group in a hospital before they... Is that what happened with you?
That's right. I was with the group for 2.5 years before starting up my own practice.
Why did you want to start your own practice? Because trying to go through and having all these other employees and mid-level... This is a headache.
It is, and somewhat it was a bit fortuitous in terms of how the whole thing happened. Some of this, you don't design it. You go along with the flow, but we are very happy where we are in terms of where I am, the ability to know people as an individual and individual-centered practice. So that's the fun of having your own practice.
And that's the key right there, is you got to know your patients personally.
True. You were able to mend your practice, or rather bend your practice according to how you want things to be.
Right.
So that may not necessarily be the case when you're in a group practice or a practice employed by a bigger organization.
When you first started your practice here, was it just you? Or
I started as a solo practitioner.
And how did you start to develop and grow your business?
Bakersfield, even though the city has become bigger than it used to be 20 or 30 years ago, still has its core group of core people,
Right.
and they're still very closely linked to each other,
Mhm.
who will speak to each other. So most people who come to the practice, they know we are who I am, and that's how the practice grew.
Not a lot of golf tournaments?
I actually don't play golf, and golf is probably the least place a golf course is the last place you'll see me. So it's not golf tournaments. It's our role ends up being supporting the primary care doctors. So
Right.
it's essentially your contact with reach to your primary care doctors.
If visionaries, our audience, want to get in touch with you, how do they do that?
It's 661-664-0100.
And the website?
It's spelled after my name. Its URL is www.aggarwalclinic.com.
And when we come back, we're going to be answering a question that every medical student and residency student asks, which is, how do you do the business of medicine? When we come right back. But before we do that, if you enjoy a Small Business Celebration, go ahead and like, subscribe, and notify, and we'll talk more about the business of medicine when we come right back. The winter season is rapidly approaching, but are the tires on your car or truck ready for wet weather? Bakersfield's best tire store, Claru Tire, has been serving families like yours for 80 years and installs and services the tires your family depends on when the wet weather comes. Give Claru Tire a call at 661-324-6069 and ask them about what tire works best for you and your budget. Call Claru Tire at 661-324-6069 or visit them at 530 East 21st Street in Bakersfield or at clarutire.com today. The wet winter weather is rapidly approaching. Call Claru Tire at 661-324-6069 today. I'm here with Dr. Atul Aggarwal, the owner of Atul Aggarwal MD Cardiology Clinic, and our visionary question comes from Tamara, who asks, I've just about completed my residency and want to start my own practice. What business mistake did you make when you went on your own that you learned from that they didn't teach you in medical school?
Sure. Of course, they don't teach you the business of medicine at all in medical school.
Right,
That's
sure.
something that you learn and you evolve as years pass by.
Right.
I could have been more versed in electronic medical records and electronic media in my practice.
Right.
So that's one thing I look back. A lot of things that when you experiment with,
Okay.
you want to keep yourself small in whatever you want to experiment.
When you talk about making experiments or doing experiments, what are some of the things that you experimented with that some worked, some didn't? What did you find?
Yeah. As a solo practitioner, to start with, you want to get to know people in the community.
Right.
So you have to be out there to know your presence, to make people know that you're there. Getting people to know you did take time. There are multiple ways. There is advertisements. There's a newspaper. There's cable. There's social media.
One of the things that you do exceptionally well, because you were just talking about social media, is you do a lot of posting and reposting on Facebook of inspirational quotes.
Sure.
Why?
I hate to term it that way, that it's my favorite waste of time.
Okay, sure.
Most of it is done, when I'm free, when I'm not involved in patient care.
Okay.
So it's a lot of, everybody has a passion to do something beyond medicine. Some people have passion for music.
Right.
Some people want to go by the sea and have a calm evening.
Right.
Some people have a lot of fun to present. Some people's passion is research. Some people's passion is teaching. So Facebook posts is just a way to, it's a small way to express yourself and to connect with people and with patients and the community.
But the thing that's so clever about this, and I don't know if it's intentional or not, but when you do this, people go, Atul sent that. Atul posted that.
Yeah.
They remember you.
Yeah, so it's a way to connect with people. It's your most soothing and thoughts that come to your mind. That's what you end up penning. And so these are, and it helps to connect with people.
Right. One of the pleasures of life are children. And you've got two boys.
Mm-hmm. Yep.
One is a senior in high school, and the other one's going to university.
He's starting UCLA this year.
Oh, going to
Yep,
UCLA.
yep,
Congratulations.
Thank you very much.
What's his major?
His major is biology.
Biology, okay. And he hasn't figured out what he's going to do yet.
He's too young. We're gonna let him figure out what he wants to
Right.
do. Younger one, he is interested in medicine also.
The whole world of medicine just kind of flows through the family. Your great-grandfather, your father, you, them.
The younger one is a bit interested in medicine to start with. Older one probably got influenced seeing what I do.
Okay.
Still, it's now our job was to get him to UCLA,
right.
And now it's time for him to grow and explore.
You mentioned that you influenced him to go into medicine.
True.
What have they taught you?
They've taught me that the importance of spending time with them
right.
is the best time of my life.
Yeah.
Everything boils down to the children. So whatever you're gonna be left with when you're not there is your children. So whatever you inculcate in them is what is your biggest wealth. Your kids are your biggest wealth. So however they end up being in some shape or form is all what you've earned in your life.
Have you taken this lesson and applied it to your practice?
Practice, it's a little bit of a philosophical question because
right.
it goes away from business per se.
Right.
Practice is what you do, and this is all I can do this lifetime. Mm-hmm. Even if I know there's most physicians you'll ask, even if somebody gives me $10 million in my bank tomorrow,
right.
we'll not stop doing what we're doing because
right.
after a point in life, it becomes your blood. You won't know what to do with your time.
Right.
And there's so many physicians that I know who are so senior and they still work just as hard as I do. Right. It's amazing to see how hard they work and the toll that practicing medicine takes on the body. Yeah. But they still want to keep doing it because that's the only thing they know right. to do. And that's the only thing they feel good about and passionate about at the end of the day. And that makes their day. So practice is what you do because that's what in some way you have a purpose that God has trained you for. And then, but it ends up being, the fruit has got to be your children. So that's what you do it for.
When we come back, we're going to talk about what on earth do you do when you've got your student loans paid off and all of your major debts? Now what? When we come right back. The reason we're talking with Dr. Aggarwal today, the owner of Atul Aggarwal MD Cardiology Clinic, is because of a Visioneer question that came from a Visioneer just like you. We had a Visioneer that wanted to find out what is a creative way to use social media to help get the word of my business out without being overly pedantic. So if you've got a question, you've got thoughts, something you'd like to learn about here on Small Business Celebration, reach out to us on LinkedIn, Facebook, and Instagram, and who knows, your question could appear here on Small Business Celebration. So reach out to us on LinkedIn, Facebook, and Instagram today. I'm here with Dr. Atul Aggarwal, the owner of Atul Aggarwal MD Cardiology Clinic. Visioneer Justin asks, my practice has gotten its biggest debts paid off and medical school paid off. Yay! What have you reinvested into your business that has benefited you the most long term?
In terms of providing office-based care, there are multiple facets to it. One is your consultations, and then you do need aid of technology to provide care. Cardiology does rely on multiple imaging modalities to diagnose illness and provide continued care. Mm-hmm. So reinvestment in some way ends up being investing it back into technology. Okay. In terms of equipment that you can provide in the office. Okay. It does need more personnel to provide more timely and complete care. Mm-hmm. So that's what reinvestment back into the practice has been. So
it sounds to me like you're not one of these people that's getting into the artificial intelligence thing in a big way.
AI is something that is going to evolve. even though it sounds like a very simple concept that I say 5 symptoms in front of the machine and it'll diagnose illness and tell me treatment.
Right.
I think we're still far away from getting AI replacing physicians to diagnose illness,
Right.
to suggest treatment modalities. So it will keep getting incorporated in some shape or form as time evolves, but
Sure.
I think we're too early into it right now.
Don't put all your stock into Chat GPT and all that.
ChatGPT is a great tool, it's a fun thing to play with, but again, this is something that's going to evolve as time evolves in
Right.
terms of diagnosis and diagnosing illness. Apple had a thing that it can look at your retina
Right.
and diagnose what your risk for heart disease is by
Wow.
using multiple. It has like 180 computational models that it uses to
Wow.
diagnose, to tell you a risk of heart disease.
Yeah.
There are multiple blood tests, to diagnose your biomarkers, we call them,
Right.
to diagnose your risk for heart disease. All these things are great tools to aid clinical diagnosis, clinical
Right.
judgment, and help devise, risk modalities and risk assessment rather.
But they still lack the important thing, which is you've got all this great information, but somebody like you still has to interpret the data.
Interpret it and apply it to the patient, apply
Right.
it to the individual. Models work great, tests work great, but how do you apply to one patient versus another?
Right.
It's going to take time for AI to replace that. I don't know if AI will be able to replace physicians in future altogether in that manner. So we are far away from that.
One of the things that I've mentioned more than once on this program is every business owner needs to leave the United States at some point and go visit another country. And this is, we were talking a little bit off camera
Mhm.
about this, and you feel the same way too.
Yeah, it's so much visible in healthcare
Mhm.
that the disparity between how good we are in US in terms of healthcare provision versus rest of the world.
Right.
Just a case in point, something simple or easy, bypass coronary artery bypass grafting. Wait time, average wait time, if so you have stable heart disease, is about 6 months in Canada
Right.
and most of Western Europe. So that's something that's unfathomable to US public, that somebody has to wait for 6 months. It
Right.
could be even somebody waits for 6 days over here. It's a wait too long for
Right.
people.
Right.
So in some way, we are used to that such prompt care. We just don't know how difficult the healthcare is in a lot of the world. So that's just one part of it. It's just we went through COVID vaccine. We were the first ones to develop the vaccine.
Right.
So it's just 9 months. That's something. 5 years ago, we could not have thought that we can develop a vaccine in 9 months. It's look at how good we are in US in terms of where the rest of the world is. So I think people need to appreciate the goodness of the country and the goodness that country provides for them. Things would be much more easier for the politicians if people understood that.
Sure, sure, sure. What makes you wake up every morning and open your business?
Some of this is philosophical, as I said, is that where God put you in to do what you're doing. Some of this is not, is of course you need to conduct business to earn your living
Right.
and provide for your family. But it all comes back to you. It all comes back in terms of what people pay back to you in terms of the goodness. It's not just how good you feel about yourself doing what you're doing. So how your friends, your family, everybody feels about what you're doing. I sometimes look backwards that it does take a toll on your body. Like, you get woken up at odd hours in the night.
Right.
It interrupts your sleep cycle, can be disrupting your sleep cycle can be very hard on your body. It takes a toll on the next day.
Right.
So, but it comes back to it, you do feel good about what you're doing. It can be very surreal when you're taking care of people with heart attacks, and it pays you back as well. You feel you've done something good for somebody, and that's what makes you wake up next day and feel good about what you're doing.
Doctor, this has been a real privilege. Thank you for joining us here on Small Business Celebration.
Thank you very much. It's been my privilege to spend time with you, talking to you.
If visionaries want to learn more from you, how do they get in touch with you?
Best way is to there are multiple. I'm on LinkedIn. I'm on Google. It's very easy to approach me through Google, Facebook. I can give my email. That's aagg@aggarwalclinic.com. So it's easy, my name, but two initials, aagg@aggarwalclinic.com.
And I'll be right back with my final thought. The winter season is rapidly approaching, but are the tires on your car or truck ready for wet weather? Bakersfield's best tire store, Claru Tire, has been serving families like yours for 80 years and installs and services the tires your family depends on when the wet weather comes. Give Claru Tire a call at 661-324-6069 and ask them about what tire works best for you and your budget. Call Claru Tire at 661-324-6069 or visit them at 530 East 21st Street in Bakersfield or at clarutire.com today. The wet winter weather is rapidly approaching. Call Claru Tire at 661-324-6069 today. Intuition. Not that long ago, we had a major summer thunderstorm that rolled through, and one of the things about Bakersfield and the rain is that when it does rain, the residents tend to go and hide. And since this fell on a Sunday, this was even better because it meant that I would have zero competition on the road. I wouldn't have any other cars, no other trucks, no other Sunday weekend warriors on the road. It would just be me and open road for miles. And as I got up that morning and I started pedaling up the hill and going up the hill, I had a headwind that came, but that was okay because it makes my heart work harder, makes my lungs work harder, makes my legs work harder. And when I got up to the top of the summit of the hill, I was able to see the entire southern San Joaquin Valley bowl, super crisp and super clear, and it was beautiful. I started rolling down the hill when a thought came ringing through my head. And it said that ambition is being self-aware of what you want. Intuition is being self-aware of what those around you want. And as I started pedaling down the hill and gaining speed and going faster and faster and faster, I started going through and thinking about the personal life goals I wanted to achieve and things that I like to do with the family and the different goals that I had with the business that I wanted to accomplish, when suddenly it hit me. No, really, it hit me. I got hit with a sprinkle, and then another, and then another, and then another. And then I remembered something about my wife. I remembered her telling me years ago that when she was young, she liked to put on her galoshes, and when it was raining hard, she loved to go out and play in the rain. And as I neared the bottom of the hill, there is an intersection where you can go left, you can go right, or you can go straight ahead. And normally, I like to make a right turn because that adds another 5 miles to the ride and about another 400 feet of elevation gain. It's really great for the continuation of the morning ride. But that morning, with the rain starting to come down, I started to think. Ambition is being self-aware of what you want. Intuition is being self-aware of what those around you want. So, I rode home. I've pedaled fast and hard, and as I rolled up into the house and put the bike away, it started raining harder and harder and harder, and I burst into the house just in time to see my wife, who was 60 seconds from getting out of the bed and had that look of, "Don't even talk to me until I've had my first cup of coffee." And with great glee and joy, I said, "Honey, it's raining." And she looked out the window with one eye and smiled, and she said, "Yes, It is. And I said, we should put on our galoshes and go play in the rain. And she paused for a moment and her face lit up and she said, yeah, that sounds like fun. And then she paused and she looked at me and she said, how did you know that I like to play in the rain? And I gave her a wry grin and I said, intuition. I hope you enjoyed our conversation this week with Dr. Atul Aggarwal, the owner of Atul Aggarwal MD Cardiology Clinic, and I hope you learned something that you can use today to grow a strong and profitable business. And until we see you next week, where we celebrate another small business making a big breakthrough. If a cardiologist robs a bank, what do the cops charge him with?
It's got to be something with heart.
Yeah.
So, he has a hole in the heart.
Close. They make a cardiac arrest. Why are cardiologists the most romantic people in the world?
They know what it's got to do with the blood to the heart.
It's because cardiologists are always thinking about your heart. Shall we start?
Yeah, please.
Okay. Welcome to Small Business Celebration and our guest.